We have a tight schedule this morning or afternoon, depending where you're calling in from. So we're going to go ahead and get started. Welcome. As I noted a moment ago, if you were not logged on yet, please introduce yourself in the chat, put your name, your organization, where you're calling in from. We'd love to see where our participants are coming from today. My name is Jessica Farringer. I'm the director of the Data for Impact project. It's a pleasure to be here with you all today. We have an exciting lineup. We are here for the presentation on charting a path towards local capacity strengthening systems and tools for mapping and planning. And this is a webinar co-hosted by Data for Impact and Momentum Monitoring, Evaluation, Innovation, and Learning Working Group. Next slide. We're presenting today in English with a live French interpretation. If you are wanting to move over to the French interpretation, you can click the interpretation icon at the bottom of the screen and select off if you'd like to hear English, or click French if you'd like to hear French. Next slide, thank you. Today, the presenters will speak in English with the live French interpretation. So select French if you'd like to see French closed captioning, or English if you prefer English closed captioning. So you have those two options. You have the voice live interpretation. There's also the closed captioning you can select. Next slide. Here's our agenda for the webinar. Currently, obviously, I'm introducing the webinar and providing some logistics for the French interpretation. Next, we will move to an introduction of USAID's local capacity strengthening policy from Barbara Rollins, the Agreement Officer's representative for the D4I project. Following that framing of USAID's policy, Meg Kinghorn and Beryl Levenger, who are consultants for Momentum Knowledge Accelerator, will present on the capacity mapping and monitoring system. Then Samson Adebayo of Data Research and Mapping Consult, or DRMC, based in Nigeria, will provide insights into a local organization's experience with D4I's research and evaluation capacity assessment tool and resource package, or RECAP, as we know it for short. Finally, we will end the webinar with a question and answer session and discussion with our panelists, and that will be led by Liz Millar of Data for Impact. Throughout this webinar, you can ask questions in the Q&A function of Zoom. Please don't put questions in the chat. Just go to the Q&A when you want to ask questions. And then at the end of the webinar, we will address your questions. Next slide. So Data for Impact, or D4I, is funded by USAID. D4I is a consortium led by the University of North Carolina at Chapel Hill. And this is in partnership with Palladium, ICF, JSI, and Tulane University. D4I strengthens local capacity to generate and use high-quality health data for strategic decisions on health policy and programming at national, subnational, and community levels. D4I investigates program effectiveness, integrates gender into all of our activities, supports adaptive management, and learns from evidence. D4I draws on the technical expertise that exists in each partner organization, and as well as an extensive network of local partners in USAID's priority countries. Next slide. To help frame our focus on local capacity strengthening, Barbara Rollins of USAID will provide an overview now of the local capacity strengthening policy. So Barbara Rollins is a senior implementation research advisor in USAID's Global Bureau of Health, Office of Maternal and Child Health and Nutrition, Division of Research and Policy. Ms. Rollins has over 20 years of management and implementation experience related to conducting monitoring, evaluation, research and learning activities for reproductive, maternal, newborn, and child health, or RMNCH programs. Technical focus areas include developing improved metrics, data collection tools, and approaches for measuring service coverage, quality, and equity, research to inform program design and scale up, strengthening RMNCH components of national health management information systems, and capacity building in use of data to improve service delivery quality and health system functioning. One note is that many of the slides in the next part of our presentation here are adapted from a presentation given by Christina Granger and Mohammed Nasruzaman to the Momentum MEIL Working Group in June of this year. So we just wanted to give them credit. And with that, I will pass things over to Ms. Rollins.
Thanks so much, Jessica, and hello, everyone. I'd like to take this opportunity to tell you a bit about localization and USAID's local capacity strengthening policy. Next slide, please. So what is localization? USAID envisions expanding the share of its programs that are locally led, where a diverse group of local actors define priorities, design projects, drive implementation, measure, and evaluate results. Next slide, please. So USAID has been going down a path of greater localization for more than a decade now. This started with the launch of implementation and procurement reform. And more recently in 2022, a key milestone was the launch of the agency's local capacity strengthening policy. Next slide, please. So this localization approach under USAID has 4 pillars. The first one is about adapting our policies and program practices to foster locally sustained change. The second one is around shifting power to local actors. The third one is around channeling a larger portion of assistance directly to local partners. And then the fourth is serving as a public advocate and thought leader at the global and country level. Next slide, please. So local capacity strengthening is really key to advancing USAID's localization agenda. And this policy really commits the agency to a number of different things, including working with local partners to define their own vision for success, strengthen their ability to be effective and relevant actors within their context, and elevating local ownership in sustaining development results. Next slide, please. We have a couple of key targets related to localization. The first one states that USAID will provide at least a quarter of all program funds directly to local partners by the end of fiscal year 2025. And the second one notes that USAID will take steps to ensure that by 2030, 50% of our programming will place local communities in the lead. Next slide, please. We are currently developing guidance around tracking locally led programs. And there are 4 key categories or areas to this guidance. And one of those is recognizing, leveraging, and strengthening local capacity. There are 14 good practices that have been identified related to this tracking. And you can see here under local capacity strengthening, there are 6 good practices that have been noted. Next slide, please. So USAID has also developed a guide to distinguishing tools used for local capacity strengthening. And this guide makes a distinction between tools used to assess organizational performance versus tools used for capacity strengthening action planning and risk assessment. Next slide, please. So we have a couple of indicators, or a few indicators we've identified. One is very well established. That's CBLD9, the percent of US government-assisted organizations with improved performance. This is an agency-wide standard foreign assistance indicator, and there are a lot of resources available to support application of this indicator. We also have a couple of indicators that are being pilot tested by the new partnership initiative. That includes CBLD10. the value of non-donor resources mobilized for local development priorities, and CBLD 11, number of organizations pursuing their own performance improvement priorities with U.S. capacity and strengthening support. So that's it for me. I'll turn it back to Jessica. Thanks so much.
Thanks, Barbara. So now we're moving to the next section of our webinar. Next up, we have Meg Kinghorn and Beryl Levenger, consultants with Momentum Knowledge Accelerator. They will introduce Momentum's Monitoring, Evaluation, Innovation, and Learning, or ME/IL, Working Group's Capacity Mapping and Monitoring System. Meg Kinghorn is an independent consultant with 35 years of experience working in civil society development and NGO and network capacity strengthening. Beryl Levenger is managing director of BL Team, a consulting group that supports governments and non-governmental organizations in strategy development, learning through evaluation, and capacity strengthening. Meg and Beryl, I turn things over to you now.
Thank you, Jessica. Great. Hello, everybody. It's great to be with you. Great to see so many familiar names in the chat and so many new names that I look forward to engaging with you further during this day. Beryl and I are really excited to present to you this initiative of the Momentum Knowledge Accelerator, the Capacity Mapping and Monitoring System. But first, just a little bit of background on Momentum. It is just a tremendous suite of 6 centrally managed interconnected awards. So very large initiative looking to make an impact on health to accelerate reduction of maternal, newborn, child mortality and morbidity, and to improve the equitable access to high quality voluntary family planning and reproductive health care. So it's really just a wonderful suite of resources and awards. It is centrally managed through the 6 primes and subs, and then also 5 mission-led bilaterals to date with the buy-ins. The Momentum Knowledge Accelerator is one of those awards, MKA, and they do just that. They aggregate, collect, accelerate the knowledge that is generated from the other awards through monitoring and evaluation, knowledge management, and adaptive learning, and also strategic communications. So we're delighted to be a part of working with the Momentum Knowledge Accelerator. Next slide. So to present to you the Capacity Mapping and Monitoring System, developed by myself and Beryl Levenger. Between the two of us, Beryl and I have been working in capacity strengthening for decades. Specifically, we've done a lot of work around organizational capacity assessment. Between the two of us, we can't count the number of tools that we have used, taught, designed, promoted, discussed. It just goes on and on. And yet, over the years, we have become increasingly uncomfortable with capacity knowledge assessments as organizational capacity assessments, as I think others have. In that they do a lot of good. There's this wonderful reflection that happens. However, they take a lot of time, often 3 days, which is a lot for any organization, much less a local organization. They've also traditionally focused on capacity or potential rather than actual performance and delivery of the things that we hope these management systems will enable them to do. There's also no recognition of these new important issues that we've come to recognize, such as systems thinking, resilience, adaptive management, experimentation. These are not incorporated into the existing tools. Also, evidence is either not a part of the assessment tools, or else it's very prescriptive evidence based on what the tool designer believes is good evidence, which isn't always appropriate for every context. And lastly, it's very weak on learning. What changes capacity? And so Beryl and I were delighted when Momentum Knowledge Accelerator approached us and asked to promote some new thinking in this area, starting with developing an enhanced capacity framework to take a new look at what would be an organizational capacity framework that could be promoted. And then second, putting together a tool to use that framework, operationalize it. And lastly, we've been working this year on developing a facilitator's guide, rolling out some trainings on the system, and then next year we hope to adapt it to other stakeholders. Next slide. So as an overview, we would like to talk about what is the CMMS, what are its features and innovations, what are the results that are generated through the system, how is evidence gathered and utilized, and then also what is available if you're interested and would like to know more. Next slide. So the CMMS is based on this enhanced capacity framework, which was inspired by a study done by the European Center for Development Policy Management in the Netherlands. It has a 5 capacity area system that does include producing sustainable results. Do they deliver on the results? Can an organization align systems for agility? Those tend to reflect the internal management and operational systems. But also, can it learn and adapt? Can it attract and sustain support? And particularly, can it foster self-determination and its way forward? So this tool and this framework really helps local NGOs and CSOs and partners to identify the needed capacity development needs and course corrections in a timely manner, so it's responsive. Next slide. Some of the innovations. We are really excited that this is not a capacity assessment tool. This is not a one-time snapshot approach. It is really an evidence-based monitoring and learning system that is ongoing, that really shifts the locus of learning and control to the local organization itself. So we're very excited about that. It is user-centric. It is based on their own vision of what they're trying to become, not what the implementer would like them to become. It has some introduces some things such as an urgency index, which combines both performance strength of the indicator statements and also a priority rating so that we can prioritize what are the greatest needs. It also introduces something that looks below performance to say, what are the drivers and determinants of performance? What's either accelerating good performance or holding back bad performance? Real-time analysis. It lets the organization identify what are the appropriate sources and uses of evidence that are then externally verified. And it integrates capacity measurement and capacity strengthening, or performance measurement and performance strengthening through 100-day plans, rapid monitoring, short-term cycles, and then the focus on those drivers. Next slide. Additionally, we really believe that this mirrors USAID's capacity development and capacity strengthening policy and the criteria of CBLD 9. It incorporates things of systems thinking, capacity, resilience, and it really builds insights on how the organization, how and why capacity and performance changes. To build into this, the organization, they can build these understandings and ability of what is good performance, what drives it, and how can they change it. And then there's flexibility and adaptiveness on the frequency. So it can be adapted to many uses. Next slide. I'm going to turn it over to my colleague Beryl, who can talk you through a little bit of the specifics of the CMMS now.
Okay. Okay, and thank you, everybody. It's lovely to be with you today. We're not quite on the right slide, though, which should be practice statements for each capacity domain. what I'd like to do is just very briefly review what is being scored. And Meg touched on some of this, but these will be some additional details. As Meg mentioned, the system is focused on 6 broad capacities. We call these capacity domains. And the capacity domains mirror the enhanced framework that Meg already presented. Under each capacity domain is a series of practices. We call these statements of practice or just plain practices. But the idea is that we're looking at observable performance rather than latent potential for observable performance. And so the scorer or the user would be working with, in a discussion context with colleagues, scoring a series of statements. Those statements are shown on this spreadsheet, and we're not going to look per se at the spreadsheet, but rather at the simplicity of the system. 5 capacity areas, a series of short statements that reflect performance, and then we're going to see what happens. Next slide, please. So we would be moving toward seeing the results. And these results are based on 3 different kinds of input that the user would provide. And then the template, the Excel template, would generate some additional scoring. So specifically, the user in consensus discussion will rate the practice. Do we do this practice? To what extent do we do this practice? The user will also determine how important this practice is in relation to a specific goal. Then the underlying factors that determine performance, the extent, for example, to which people have the necessary knowledge and skill, the extent to which supervisors are aligned with a particular goal and practice, the extent to which resources are available. These are examples of what we call drivers. So the user, in consultation with others, rates the practice, determines the priority, and then individually scores the driver rating, the underlying causes of performance. And then the template will automatically generate an urgency index. Is it urgent that we work on this particular practice? Would it be nice if we worked on this particular practice, but not necessary? Or at this time, we could work on this practice, but it is not a priority. Next slide, please. So the Excel template is a tool that generates quite a bit of information. Specifically, what it does is allow the user to see those scores aligned in many different ways. For example, as a user, I could determine that I want to view all of the practices to which I've assigned a high priority, and then the Excel template will generate that view. Or maybe what I want to see is where are my resources most efficient, and that will be generated as well. So these, what we call filters, are just different ways of viewing the data. And what's exciting about this particular template, and Meg already mentioned this, but now you'll get a sense of what she meant, is that it generates real-time analysis. The discussion is completed, the data is entered at the same time, and immediately the analysis begins, and users, once they have completed the independent driver survey, are able to understand where each practice fits with respect to performance, urgency, priority, and the underlying causes of that performance. Next slide, please. So this is just a snapshot of what a user would see in Excel, and it's visual. So there's not an array of numbers per se, but rather color-coded, flag-coded visuals that direct the user instantaneously to where are we strong, where is there an opportunity for significant performance enhancement, where are our drivers supporting performance and where might they be deficient if we want to achieve high performance. The most important thing I think about this system is that it not only looks at what is, but why it is, so that users can focus on underlying causes of performance and not just the capacity for performance or latent capacity. Let's go to the next slide, please. So we mentioned earlier that this is an evidence-based system, and we also have used the word system. And what I'd like to do is just focus on how evidence is used. Evidence is embedded in the monitoring process after the first initial launch of the system. So the user, and again, it's a team of users, scores their performance. Now, if you scored your performance there are 3 levels, essentially. At the lowest level, you don't need to show evidence of why you're seemingly deficient. But if you've scored your performance at any level above that, you marshal a package of evidence which would be examined and scored in terms of the extent to which the evidence supports your claim of competence. So this would be an external committee that looks at whatever evidence the team decides to marshal on behalf of its scoring decision. And what's important is that the evidence is scored not whether the evidence is believable or appropriate, but rather whether it makes the case that a particular practice is being exhibited, manifest by the user organization. So this evidence would be used periodically in conjunction with monitoring, and we'll talk about that in just a moment. Let's go to the next slide, please. So this is what the process overall looks like, and you could see the light bulb shining brightly at the 3rd stage. So there is a stage of preparation where the team determines its goal and puts together the ways in which it's going to work. Then the actual mapping is done. That's the scoring of the statements. And then eventually we move to what is really the heart of the system. And that heart involves strengthening and monitoring. And here's where 100-day plans are proposed. Here is where evidence is presented and reviewed and potentially rescoring occurs. And then once this cycle of 100-day plans, monitoring, evidence review is completed in a given, say, calendar year, there is an evaluation at the end of the cycle. This may be a 3-year cycle that coincides with the life of an award, or it could be a shorter cycle that the organization itself deems important. Meg mentioned, and this will be my closing commentary, Meg mentioned that this is user-centric, and I just want to highlight the ways in which it's user-centric. It's the organization, the user, that decides the priority. It's the organization, the user, that chooses and selects the evidence. It's the organization or user that develops the 100-day plan. And it's the user that also determines ways in which drivers will be strengthened in order to strengthen performance. So let's go to our last slide, please. So at this point, where are we? Meg highlighted some of the progress we've made to date. We have, in fact, piloted and we have proof of concept. We are just in the final phase of our facilitator guide. We're doing virtual training in late September. And our hope is that next year the system will be modified and developed for a different user population, illustratively a clinic or a government department. We are thrilled that you have had the time and interest in our work and look forward to your questions. Thank you.
Great. Thank you, Megan Beryl. Now that we've heard about this tool, DeFry would like to share its experience with capacity strengthening through the recap tool. We are going to hear from Samson Adebayo of Data Research and Mapping Consult, or DRMC, about their experience with capacity assessment and planning for D4I's USAID Nigeria Health Population and Nutrition Multi-Activity Evaluation. Samson Adebayo's specialization is biostatistics with an interest in sexual and reproductive health, maternal and child health and nutrition, family planning, and statistical modeling from a geostatistical point of view. His career has spanned academia, WHO, consultancies, and he is seasoned in public health research. He joined DRMC in 2022 and is currently the project director for the USAID Nigeria HPN multi-activity evaluation with D4I. Samson, over to you.
Yeah, thank you, Jessica. Good morning to everyone over there, and good afternoon to people from West African region. I'm going to take us through the experience of Data Research and Mapping Consult Limited as a local organization that has benefited from this collaboration with D4I. Next slide, please. Next slide. Yeah. Here I want to talk to us about how recap support D4I and DRMC in particular, using DRMC as a case study. The tool was to assess the technical and management capacity for conducting research and evaluations with the aim of providing evidence-based findings for decision making. Then recap users create actionable plans for institutional strengthening, and this was in conjunction with D4I, and they designed to strengthen country and organizational capacity to address local information gaps, local health information gaps, with the aim of receiving direct awards from USAID and other donor agencies. And it's good to mention here that this capacity that DRMC has benefited from these collaborations cannot be overemphasized. Next slide. Next slide, please. Okay, yeah. Here I'm going to give a typical example from a DRMC perspective, which is how DRMC has benefited from this collaboration. Like I said earlier, it is a research-based agency in Nigeria, and we partner to co-implement a large-scale evaluation of USAID-funded activities in Nigeria, basically in the selected project states. We use the recap to identify organizational priorities for capacity strengthening. Prior to the commencement, there were a kind of checklists that were exchanged with DRMC from D4I, and these we completed. And at the end of the day, the strength and weakness of the organization was identified. A picture here is one of the sessions where we were actually having hands-on training with the support from D4I. Next slide. Okay. Yeah, here we have extracted a few findings from some of the assessment with DRMC. So here I'm going to talk about the results from domain 5, that is information sharing. And generally, this subdomain, we have a score of 3.5 as interpretation and gender integration. From this, we can see that on the right side, you see some findings there too. From domain 5.2, subdomain 5.2, again, the average score was 3.5. And this subdomain has strategy, writing, visualizations, production, and facilitation as the areas that we concentrated on. For 5.1, some of the findings shows that before there was no qualitative. We need to learn it. I need to expatiate on this. Prior to this collaboration, DRMC has virtually been avoided submitting proposals for qualitative research because we feel that we do not have adequate skills to be able to successfully carry this. On gender integration, most of the time we do this, but really depends on what our client wants. Always keep option to integrate the gender divide in our analysis, especially in our recommendations, but we must follow what the client wants. Here again, most of the times we do not have our own independent opinion. Rather, whatever our clients want, that is what we always present. And on dissemination and writing, specifically as individuals, we have people who have published and who have participated in a lot of national surveys in Nigeria. Some of these involve report writing as well as some journal articles writing. But as an organization, DRMC, this has never been part of what we have done. Yes, at best, some organizations or some clients, they want us to generate some descriptive findings and write reports based on this, but not with deeper insight into the context of such analysis. Next slide, please. Next slide. Yeah, this is the conceptual framework that was adopted because of this collaboration. That is the institutional strengthening framework was adopted, which goes from review results in the executive worksheet and prioritization of needs, then designing a plan on how to address the needs, and of course, coming up with actionable points on follow-up, what needs to be done after this. Next slide. Now, here I'm trying to show us what happened in the course of this collaboration. That is the approach, the process, and the output at the end of the day. The approach that was adopted is learning through action. That is integrating training during every stage of the evaluation process. Throughout the collaborations, we ensure that there was a rigorous training with leadership from D4I, collaboratively engaging in actual evaluation activities. In this case, we were actually the foot soldiers who carried out the administration of the survey questionnaires, being in the field, creating an enabling environment for the researchers, as well as ensuring that we have adequate advocacy consultation with relevant stakeholders. Then D4I provides ad hoc support and engages in capacity building activities on a case-by-case basis. As at any time that we need, they were always there to provide guidance, which is what has led to the improvement that we can see in DRMC capacity as a local agency to carry out sustainable research and evaluations. That started between July and May 2023. Between July and August 2022 was the period for data collection through collaborative review of data collection processes and tools. The instruments were developed thanks to D4I for giving DRMC opportunity to make input into the tools that are developed. And of course, there were tailored training on data collection in terms of the use of CAPI and the administration of the questionnaire, as well as addressing some bottlenecks that may come up. Then September 2022 to January 2023 was dedicated for data analysis. This case, we were involved in reviewing of the codes and coming up with relevant codes with the support from D4I. So we had what we call collaborative development of code books and co-coding of qualitative data. We use Deduce software for this, Until that time, DRMC had never used any software for qualitative data analysis. Our first experience was the use of DDs, which again was part of the dividends of the collaboration. So we had virtual training sessions on thematic analysis and memo writing. This was for quite some time, and all the key researchers of DRMC who were involved in the qualitative research were part of the training and were actually part of the coding of the qualitative data in line with the thematic areas. Between January and May, we've had series of dissemination of findings to different stakeholders and to different states. Donor agencies, implementing partners were also part of this. DRMC, prior to all these disseminations, we had a kind of rehearsals over time with which we were able to build our confidence in ensuring appropriate delivery of findings. Then joint development of presentations for stakeholders and partners. So I've mentioned that. Next slide, please. Next slide, please. Okay. Now, despite all these benefits that we have enjoyed from this collaboration, we try to bring up some of the facilitators and some challenges based on these the use of this participatory tool. Recap. As facilitators, we find the application of an integrated approach very useful. Integrated in the sense that we were involved. I actually gave the DRMC opportunity to learn from them and to be involved in all the processes. Also, adoption of a system perspective. This was also a key facilitator that we realized from this collaboration. On challenges, there are some competing interests in activity timelines. This actually has to do with the stakeholders. Some of the participatory research that we wanted to do with them took us longer than anticipated because of conflicting interest based on the activities. They would have had another schedule, but by the time we got there, we had to work around that. And with the good and deep advocacies that we had carried out, we were able to surmount some of these challenges. Also, challenges related to long distance collaboration was found to be of a great issue. Measuring performance is also more difficult than assessing the latent capacity, as one would have thought at the beginning of this exercise. We try to bring some of these quotations from DRMC's perspective. For instance, this says, the contacts I had with the D4I have greatly enhanced my research capabilities. Specifically, I've learned more about qualitative data collection methodology. My skills on thematic analysis of qualitative data were also significantly improved. Moreover, for the first time, I was introduced to and mastered the most significant change methodology. This came from one of the DRMC researchers. Another useful quotation here says that our partnership with D4I will surely impact positively on our future work, especially to someone like me who still pursues research work. With the theoretical and practical knowledge acquired, we will now be able to carry out qualitative studies in a better way in research design, data collection, and analysis. These are part of the extracts from feedback from the RMC. Next slide, please. Next slide. Okay, how to access a recap. We are glad to announce to viewers on this call that the recap package is available on the D4I website, and a webinar held on June 2022 provides more information on how to use the recap tool. And there are some toolkits that are also available alongside with the package. Next slide. Thank you for your attention. I will now get back to Jessica. Jessica, over to you, please.
Great. Thank you, Samson. I will now pass to Liz Millar, who's going to moderate the question and answer session. Over to you, Liz.
Thank you, Jessica, and thanks very much to our presenters who will now be our panelists. So what I plan to do is we have a few questions that we'd like to pose to our panelists to respond live here. And then also I'll point all of the attendees towards the Q&A function at the, you can access that for most people at the bottom of the toolbar of your Zoom screen. If you open up the Q&A function, you should be able to see the questions that other attendees have asked. Many of those, if they're more specifically related to one tool or the other, we've tried to answer those as we go with text responses. So you should be able to see that and access that if you're interested in that. And we would now like to pose some questions to our panelists that sort of tie us back to the localization policy that Barbara discussed in the beginning, as well as to consider capacity strengthening across both tools. So the first question I would like to ask of our panelists is, as USAID and other donors aim to increasingly shift funding and leadership roles to local actors, what challenges and barriers remain to be addressed in terms of capacity or other factors related to this? So I'll turn it now to our panelists. Let's see, maybe I can call on Beryl or Meg. Would either of you like to start?
Sure, I'd be delighted to do that. I think that one of the biggest challenges is placing the user or the organization in the driver's seat in terms of such things as marshaling evidence, assigning a priority to practices, in general, working through plans. The policy brilliantly focuses on local ownership, but we come out of a culture where local ownership may not transfer or translate particularly well to the field of capacity assessment. Most of the tools that are available to a user determine which capacities and how important they are with relatively little input from the user, whereas this particular system that we have described begins with the goal setting exercise, and all that follows is based on the user's goal. So I think the biggest challenge, again, is really putting users, organization in the driver's seat in terms of defining capacities and responding to the capacities that are most aligned to specific goals. I'm sure that others will have comments on this as well, so I'll stop here.
Thanks, Beryl. Meg, did you want to add?
Yeah, I think Beryl did quite a good job, but I think the transition is so difficult. Our traditional capacity assessments tends to focus on structures and systems and a lot of compliance and job descriptions and things like that, without really turning over that understanding of capacity and what drives it to the organization. And so when there is a shift to localization, to locally to direct funding, it is such a big leap when they haven't really taken charge of that thinking and analysis and building relationships with them for themselves. So we hope the system will help mitigate some of those challenges.
Thank you, Meg.
Certainly a big challenge to be wrestled with, for sure.
Samson, do you have anything to add based on your experience with RECAP? Samson, if you are responding, you're still on mute. So that's fine if you don't have anything to add, but just let me know and we can come back to you. Okay, let's move to the next question. And there's a question in the Q&A that sort of relates to this as well. We heard in the introductory portion of the webinar how USAID distinguishes different tools related to capacity strengthening, and both CMMS and RECAP, as we heard about, are tools that are designed to catalyze capacity strengthening. So thinking about the difficulties in measuring performance, measuring improved performance as a result of those capacity strengthening efforts, what lessons can be leveraged from your experience with these tools that could help organizations plan for measuring improved performance that results from those capacity strengthening efforts? And Samson, I see you've taken yourself off mute, so let me go to you first and see if you have comments related to this question.
Yeah, thank you. Which of the questions do you want me to respond to now? There are quite a number of questions on the question and answer box.
Yeah, thanks for that. We're trying to answer some of the questions in the chat, if possible, or in the Q&A, if possible. So let's turn our attention to the first question there that's posed by Ashley Souza. Asks about measuring improved performance and just considerations for that or lessons from using RECAP or CMMS that could help us think about measuring improved performance.
Okay, thank you. Yeah, from Nigerian experience, measuring improved performance was something that in the course of this collaboration we found to be of great benefit. For instance, like I said, DRMC, for a long time, we have refused to respond to requests for proposals that would involve qualitative research because we knew that we did not have adequate capacity to be able to do that. However, now we can confidently, and I still repeat, we can confidently take up any research, be it qualitative or quantitative, and with that can be alluded to the capacity that has been built from this collaboration with D4I. Then somebody asked a question also about the most significant change. I saw that Jessica was trying to respond to that. So maybe if there's anything for me to add to that too, I'll be glad to do that. Thank you.
Thanks, Samson. Beryl or Meg, would you like to respond to the question about measuring improved performance?
Yeah, great. Thanks. Great question. And we believe that the CMMS really is looking at measuring performance, not just capacity, because each of the 25 practice statements are practices, their behaviors, their performance. What does good performance in financial management look like? It's not necessarily all the manuals and things which traditional assessments look for, but it really focuses on, are we able to deliver timely and accurate reports to those that need it? Now, that could be a very low level expectation for an organization that has a local grant from, say, an embassy, or it could mean, does it comply with USAID compliance regulations? So that depends on the context, and yet that focus is a performance statement. And there are many examples. So we really feel that this doesn't get into the trappings of capacity structures, manuals, things like that, but really looks at what would good performance look like in that area, in those 5 areas. Beryl, do you want to add?
Yes, just one sentence, which is all of the behaviors that are tracked and scored with respect to the CMMS are all observable. And this has been very important to us. So these are not theoretical constructs related to performance, but actually observable behaviors. And therefore, it is relatively straightforward to gather evidence to support the practice under discussion. And this is not latent capacity. And we have made a distinction, which others have made as well, between latent capacity, meaning you are capable of doing something, not necessarily that you're doing it, and manuals and documentary evidence are examples of evidence in support of latent capacity, but our focus is on what organizations actually do, and the evidence would be around what the organization did to exemplify the practice in question.
Thanks, Beryl. And I wanted to point people towards, we're trying our best to answer as many of the questions as we can, either on live now or through typing. So be sure to pay attention to the Q&A window. And some of the questions, I think I've put in links to available recap resources that are available on D4I's website that should help with some of those questions as well. I think we have time for maybe one more question before we wrap up. So I see a question here for both tools. What kind of feedback have you received regarding the required financial and human resource inputs? So my understanding is that is regarding the financial and human resources required to use the tool and to facilitate the assessment guided by the tool. So let me see, Beryl or Meg, would you like to answer that?
Sure. We believe the mapping system, we have proof of concept that the mapping can be done in a half a day, 4 to 6 hours. There's preparation work, so it can be spread out, but that's about 4 to 6 hours. It's a meeting in an office with an Excel spreadsheet and a projector. So it's low financial inputs. And then the monitoring that happens about every 5 to 6 months, that is just a matter of a couple of hours. So it's we feel it's much lower lift in terms of financial and human resources.
Thanks, Meg. Beryl, did you want to add?
The only thing I would add in terms of the lift level is that the template automatically generates all of the analysis so that it is produced in real time, whereas most tools would have an interlude between actually doing the scoring and doing the analysis. So the lift load is diminished by the fact that the template automatically does the analysis and highlights where further work might be called for.
Thanks, Beryl. And Samson, I just wanted to see if you wanted to add anything related to that last question about required human or financial resources to use recap.
Okay. Regarding the resources that will be required, first, I think commitment and readiness to adopt changes should be the first thing. So it should be a kind of orientation. So readiness to learn new things and to do things differently will be the first thing. And for human resources, one should just have qualified personnel who are also they are ready to adopt new procedures. On funding, I may not be able to say precisely on what financial resources will be required. I think D4I will be in a better position to respond to that. Thank you.
Sure, thanks, Samson. And we do have some guidance about that included in the recap tool guidance itself that I dropped the link for earlier. And it may vary depending on how the organization wants to use the tool, if they want to include an outside facilitator or feel comfortable doing it within their own organization. Also put my email into the chat, so if people have specific questions related to recap, they can feel free to follow up with me directly. But I do see that we are at time now, so I just wanted to take a minute to thank everybody, our panelists, USAID, Barbara and Jessica for the introductory, as well as Sally and Matthew here at D4I for keeping us more organized and moving on. And thanks so much for your attention and your great questions. And I wanted to see, Barbara, if you have anything you wanted to add in closing or additional comments to make before we end the webinar.
Thanks so much, Liz, and thanks to everyone for joining. We really appreciate your active participation and great comments, and thanks to our panelists.
Thanks, Barbara. Oh, and I also wanted to make sure I point people towards the upcoming first annual local capacity strengthening policy forum hosted by USAID. Sally has just put the link in the chat to that, so be sure you register to continue this conversation. And I will also put my email in the chat if you have specific questions about web recap. Sumia has put her email regarding to CMMS. And thank you so much for joining us today. We will send out a recording of this webinar within the next week or so to all registrants, and have a great rest of your day.
Thank you. And
Thanks, everybody.
Thank you. Bye.